most known theory. Oh, sorry. Okay. It's the most known theory on this, and Carstensen that came up with this positivity effect, and she started studying this in the US. She came up and explains this positivity effect with this social emotional selective theory that says that since the time is limited of an older person and they do not have too much time or motivation to focus in negative information, and also they need to focus in things that gives more reward in the present, so they do not have like this long lifespan that they can plan and they can let it to the future to do something rewarding for them, and also they pass through so much in life, but then there's still some debate on that. Another one is this brain change, that it's obvious and is well known that older people, they have this cognitive decline. So the brain is changing. So they lose a lot of properties, a lot of also the brain math in general. And the processing of automatic information in the environment, in the environment, it's easier. It's believed that is easier than the control processing. And some theories says that positivity effect, is something more automatic, that that older people, they do not think, they do not think to be positive. It's actually an automatic process because it's an easier processing of information. And also the aging brain model says that since the amygdala, that is responsible, or one of the main a part of our brain that is responsible for processing emotional information, especially fearful and sad stimuli, changes in the older people, and they actually process emotion more. They use amygdala more for positive information as well compared to the negative one, and with the younger people. So has a lot of these theories trying to explain this positivity effect. And since the amygdala is also associated with automatic processing in general, it's believed that positivity effect isn't at the automatic level, when the stimuli is so fast that you actually do not think to identify it. And then we have some findings that shows that positivity effect is associated with better cognitive abilities. So older people that actually they perform better in some cognitive tasks, like some memory task or some cognitive flexibility task, they are more positive in general. And other studies shows that positivity effects can also be found in declining cognitive abilities, such as Alzheimer's patients. So, however, the literature is still a little bit confusing on regarding to that, because some studies, they do not find positivity effect, but the majority they do. And also the paradigms they use are really different from each other as well. And then we came up, we thought about this combined view that positivity effect maybe can be a product from the control processing and also from automatic processing. So the older people, it's something at the automatic level that actually there are brain changes and they do not think, and they are positive and they pay attention on this positive information. And also that they do have this control processing of thinking and memorizing and then remembering or paying attention or making some decision after this more elaborated thinking. And then the aim of this study is to investigate the presence of positivity effect and its relation with controlled and automatic emotional processing in Hungarian older adults, because this study have not been done in Hungary yet. And from I don't know, from an informal social point of view, not something scientific, but Hungarian older people can be pretty negative, and the population in general. So it was really interesting studying this term as well, from what we see from the streets, from the people that we interact with. And then we use this dot probe task, that is an attention task. It's very well used in a positivity effect literature, and it was one of the first paradigms used to investigate positivity effect when Carstensen from the beginning of the 2000s started using it. And we divided our sample into groups. the younger adults from 20 to 30 years old and older adults above 65 years old. So we got these age differences from the literature. And we based our research a lot on the study done from Gronchi in Italy that used the same paradigm. So we have this dot probe task that is basically the participant. I don't know if you heard of, but I will explain really quickly. The participant, as you can see here, they have this black screen. It's a behavioral task, so they need a computer to do it. A black screen is going to appear with the fixation point in the middle and then the two images are going to appear, two faces, two emotional faces. These faces are happy and neutral, angry and neutral, and sad and neutral. Can be one of those. I think if I can, just so you can see a little bit better. So these are two the same face of the same person. And the stimuli appeared for the participant for 100 milliseconds to check this automatic processing in a task. So it was a whole task of 100 millisecond stimuli. And on the other task, it was 500 millisecond stimuli for the control processing investigation. So the face appeared, and right after this time, a dot would appear, or after one face or after another face. And then the participant just needs to press a button if the dot appears on the left side of the screen or if the dot appears on the right side of the screen. So it's pretty simple task. So they need to focus on the dot after the screen. And the idea of this task is that based on how fast they were to respond where the dot was in the emotional faces, we calculate this bias, which face they were paying attention to. Okay, I hope you're following. So we used this Karolinska-directed emotional faces. It's a database, a psychological database that has been used in other studies as well, and is really valid. To evaluate cognitive ability, we use the MMSE, the mini-mental, for participants that if they had some cognitive decline, we were excluding these participants. So all other people here, they were cognitive able. So they didn't show any decline based on that. And also the depression anxiety stress scale that we used to know how it was their mood, how they were emotionally, to also be discarded from the study if they show some really strong depressive mood, for example, with these questionnaires. Okay. So what we used to check our response and to see our results, it was basically the reaction time, so how fast the participants responded to those dots after the images. And we have also this ABI, that is the attentional bias index, that we basically subtracted the incongruent trials from the congruent trials. What does it mean? Incongruent and congruent. Incongruent is when actually the dot showed up after the neutral image, so not the emotional image. And the congruent means that the dot shown after the emotional image, which means that a positive score, so if you subtract the incongruent to congruent trials, the positive score means an attention to the emotional phase, and the negative score shows an attention away from the emotional phase. I know that can be a little bit confusing, but I'll show the results, and it can be a little foggy, but in the results, you understand, I hope. And then we have used derivative measures ANOVA with 2 levels of durations, of course, because we have the 100 millisecond task and the 500 millisecond task. We had 3 emotions, that was sad, happy, and angry. 2 levels of congruency because we had the incongruent and congruent trials, and we have younger adults, older adults, and we also did independent t-tests to compare these ABI scores. So the results is what's more important. In total, we had not so many participants as we wished, because the data collection was done in the COVID time. So we actually had to go to the participants' houses, and it was a really time-consuming process. But we are restarting the data collection now to increase this number, to publish this paper finally. So here you can see we have 31 older people and 29 younger people. And the mean age are those. The older people mean age is 71 years old, and the younger people 22 years old. And here a little bit of the the results that you can see. So this here means the emotions, as you can see in the horizontal line, and the vertical line means the reaction time in a log transformation that we did to normalize the data. So these numbers represent just a factor from the reaction time, is not the reaction time in milliseconds exactly. As you can see, for the controlled processing, so for the control task that is here, the younger adults, they were faster because the reaction time is lower, as you can see, and the other adults, they were slower in general, but this was expected. And as you can see, they actually were faster for the angry, both of them, for the angry faces, which means that the older people in the control processing, they did not show this positivity bias. Actually, both were paying more attention in the angry images. And in the automatic processing, actually, the difference from each other, they didn't differ much. Only in the sad condition that I'm going to show you with the t-test that you have done. So the results were not that positive as we expected, but we were still very happy with this. And talking about the sad result from the automatic level. So, oh no. So here, okay, it can be a bit confusing, but here we found some significance for the sad condition, S means for the sad condition, in the 100 millisecond. So we found the effect size here of 70, like the very last column, for 7.7. So this indicates that in the automatic level, the older people, they showed some preference to the sad face compared to the younger people, our younger participants. And then this is like completely different from what we were expecting. And you have some discussion and some reasons why this happened. So basically, positivity effect has not been found in this study, in this Hungarian sample. We actually found this preference to angry images in the control processing to both populations, the older and the younger people. And then in the automatic processing, we found the older people attention to side images. And then we have some theories to explain this, to back up this. Still bringing this evolutionary psychology view that is really important, the attention to the negative information, to the angry information, for example. But this has not been shown in past 2 studies in Italy, that actually older people showed this bias to positive, not negative information. And also another positive explanation can say the negative emotional phase tends to be the faster stimulus to be processed due to its threat signalization in automatic manner. However, sad faces, they are not that threatened. So it would explain a little bit this theory if it was regarding the angry faces and the automatic level, not the sad one. Also, we have seen a younger adults avoidance to sad faces. It was maybe perhaps as a defense mechanism. We are not sure, but there are so many theories out there that can explain so many things. Other possible explanation and things that we discussed is that aging, in some research that was found, that aging presents more sensibility to process emotional information in general. And a contrary view to positivity fact is this, that I have found in the literature, is that maybe old people has a different motivation. And since they have so many losses in life in general, they can focus also more in negative information. And since they have these limitations, maybe they are more prone to this, to process negative stimuli, which go against the positivity fact theory. But it's another view as well. So we could in the future develop that. And another thing is the importance in this study that we realized to address cultural background, that culturally is different how you address emotion, and from the past as well, from a cultural and historical perspective, what these people in Hungary in the history, how they were affected in their young ages, and maybe this can affect as well. And it's a huge gap and a huge lack of studies in the Western world and Western Europe in general, because you found these positivity effect findings usually in developed countries. And also, the Hungarian population, they face assistance issues with a poor elderly care system. So here in Hungary, they have a lot of issues regarding pension, especially if they live outside from the capital. So the older people here, they still suffer a little bit regarding health assistance as well. And with these studies, we also are trying to create some awareness of like a look to this population, because we know that the world is aging, and here is not different, of course. Finally, to conclude, the present results suggest that positivity effect is a complex and not universal concept that is not controlled or automatic process independent, perhaps. And aging thus is a complex area. However, despite its cognitive decline, it still demonstrates attention or preference towards emotional stimuli. So for the future, we know that this study has a lot of limitations. It was during COVID time. This also could have affected. It was in the lockdown period. And for our future, we are expanding this study to other countries as well. And maybe also integrating other better paradigms, not an attention paradigm, but transformational. Here are some of the references. And thank you very much. Sorry for my long speech. Thank you.